Hello friends, if you haven't yet subscribed to the channel, it will be a good time to subscribe now. Hello friends, this is a short topic, a short video on asphyxia because asphyxia was asked last year in some of the first prof exams. So let's see what you should write if it is asked as a short note. Asphyxia, first of all, it's a very tongue-twisting name, so you might have to repeat it twice or thrice to pronounce it correctly. Asphyxia. All right, it's a life-threatening condition. First things first, you must understand that it's a life-threatening condition. The body is deprived of oxygen. So, it would be hypoxia, of course. But why it's separate, different from hypoxia is because hypoxia can occur gradually, whereas this is a very impending death type of situation. Life-threatening emergency situation, often due to obstructed airway. That's the most important part, that the airway has been obstructed. There could be a few reasons for it. It could happen in drowning, it could happen in strangulation, hanging, it could happen in certain gas poisoning like carbon monoxide poisoning, etc. So, airway is obstructed. That's the basic cause, and therefore oxygen is unable to reach the alveoli and is therefore unable to reach the body tissues. Right, that's the asphyxia, occlusion of the airways. Example, strangulation. Now, what happens in this condition? There would be, of course, hypoxia, low PO2, oxygen is not reaching the lungs. Acute hypercapnia, that is high PCO2. Of course, because carbon dioxide from the lungs is unable to come out because airways have been obstructed. So therefore, acute hypercapnia, that is high partial pressure of carbon dioxide, and of course, acidosis, decreased pH. We have done this a number of times, that the carbon dioxide is an acid. It's a volatile acid. Wherever in the body it combines with water and it forms H+. So CO2 means H+. CO2 forms H+. It's an acid. So if the CO2 accumulated in the body, it means H+ accumulation. And H+ accumulation means acidosis. All right. So this is what happens. Now, there are two stages in this. One is the instant reaction or instant manifestation, and then subsequently, eventually what it might lead to. So immediate is the compensatory mechanisms. There is massive stimulation of breathing. You know, carbon dioxide is a great stimulator of central chemoreceptors. So there will be a massive stimulation of breathing, and therefore there will be violent respiratory efforts. As you can imagine, hanging, strangulation, drowning, in all such situations, there is violent respiratory effort. So this is what will be seen immediately. And increased catecholamines, that's another reaction. You know, whenever body faces any kind of stress or challenge, there is increased sympathetic discharge or increased level of catecholamines, and therefore there is increased heart rate and increased blood pressure. So apart from respiratory fallout, there is also cardiovascular manifestations seen in the asphyxia. So increased heart rate, increased blood pressure. Eventually, if the treatment is not given promptly, then the respiratory efforts begin to cease. So after the immediate reaction, the violent respiratory effort will begin to slow down and cease and stop. There would be hypotension and bradycardia. So what started as increased heart rate and increased blood pressure now has come down to decreased heart rate and decreased blood pressure. There would be hypoxic myocardial damage, since there is low oxygen supply to the body tissues, particularly the heart muscle deprived of oxygen. Hypoxic myocardial damage, plus there is increased circulating catecholamines, which we saw already. These two factors combined together might lead to ventricular fibrillation. So the fallout is that there is arrhythmia, ventricular fibrillation, and then eventually the heart may stop. So the outcome, what would be the outcome of this condition? Artificial respiration should be started as soon as possible. And when I say as soon as possible, it should be within next 4 to 5 minutes. As soon as you note the condition, the person is suffering from asphyxia, within next 4 to 5 minutes, artificial respiration should be initiated. Otherwise, it results in cardiac arrest. As we saw, there would be ventricular arrhythmia, ventricular fibrillation, cardiac arrest will follow, and the heart will stop. So this is what happens in asphyxia. There is a special variant of it, which is called as perinatal asphyxia, sometimes called as asphyxia neonatorum, that is asphyxia in the newborn. This is a distinct entity, so I wrote it separately. It's a fetal asphyxia. Now, what happens in this? Abrupt disturbance that interferes with placental gas transfer between mother and fetus. Fetus is yet to be born, or it may sometimes even happen immediately after birth. But then what happens is that interference in the gas transfer between fetus and mother, there is a placental gas transfer which is disturbed, which is blocked, and resulting in fetal asphyxia. What are the common causes? Abruptio placentae, again a tongue twisting nomenclature. Abruptio placentae, sudden removal of placenta from its attachment, placenta getting detached from its uterine wall. So abruptio placentae, or prolapsed umbilical cord, or sometimes even intrauterine state, umbilical cord getting around the neck of that fetus and causing strangulation of the fetus. Major consequences: there is depressed myocardial function, as we saw even in the adults. There is depressed myocardial function and reduced cardiac output. So metabolic derangements in the brain will follow in the fetus. Neurons, glia will be affected because of these metabolic derangements. So that was a short content that you can write if this comes as a short note at the first prof level.